We've had a whole lot of misconceptions about IVF. I know at some point in my days of ignorance, I used to think IVF involved harvesting the egg. That concept of egg on its own too was also a strange concept entirely. I used to think it involved harvesting the egg, dropping it somewhere, like a basket, incubator or something, getting sperm, and then afterwards transferring it. The whole thing didn't make sense to me. It did not. And I'm sure there are 1,001 people out there who are also confused. So I really want to know, we want to know, what is IVF?
Yeah, thank you very much. And I think this is a very important question.
Okay.
As basic as it sounds, there's a lot of misconception about what IVF really is.
Sure.
You know, I've seen couples before, with different level of civilization, exposure, socialization, and after consulting with them, I would tell them that we may need IVF as a means of going forward with your treatment. And the couple goes as if that's the end of the world. You know, as if it's a taboo to mention IVF in the course of their evaluation or treatment. So really what IVF is a form of assisted reproduction technology where the egg of the woman is retrieved in the theater into the lab and fertilized with her partner's sperm.
That one is also retrieved?
Yeah, well, it could be retrieved. It could be produced by some means.
Wow.
Yeah, and the egg and the sperms are mixed up in a petri dish in the lab where fertilization happens. You know, after fertilization, these eggs are cultured. The product of fertilization, call it zygote or embryo as we will call it, are cultured for a few days, 3 to 5 days or 6 days, then before it is transferred, or they are transferred or transplanted or implanted, whichever word seems right in this state, into the woman's uterus. You know, and then hopefully implantation happens and pregnancy takes, and the woman gets pregnant and carries this pregnancy like every normal pregnancy.
Like normal pregnancy.
Like every
and there's
pregnancy.
No complications.
Oh, well, complication, you wouldn't say, I wouldn't be able to say there will be no complications, because the fate of a normal pregnancy, or rather a pregnancy that is conceived spontaneously, is the same fate that also meets the IVF pregnancy. So IVF is the same as any other pregnancy. The only difference is the modality of fertilization. In a normal state, when no assistance is needed, a man has an intercourse with his partner, and the sperm is deposited into the vagina of the partner. The sperm swims into the uterus and somewhere in the tubes where it meets with the egg of the partner, and fertilization occurs there.
This is what you call spontaneous?
This is spontaneous conception. But there are so many reasons, as we'll find out much later, why pregnancy may just not occur spontaneously. And the only means, or the most logical means where pregnancy could occur, is to get these eggs retrieved from the ovaries of the woman and her partner's semen or sperm gotten, produced, or retrieved surgically from the storehouse of the sperms, and fertilization occurs somewhere in the petri dish in the lab.
When you mentioned dish,
I start thinking, you know, the word test tube, or usually the word test tube is used to be synonym with IVF, test tube babies and all that. So it actually gave it a name that is not very befitting. The fertilization actually happens in the petri dish. You know, then the sperms are mixed with the eggs in the petri dish and allow them to randomly fertilize. That is what happens in IVF. But then we have the advanced kind of assisted reproduction technology, or IVF, where the sperms are not so many, very scarce resources, and then you select a single sperm and have a single egg or oocytes, and with the aid of a machine. We call that ICSI machine.
Okay.
There are of different types. One single sperm. A single sperm is used to fertilize. You inject it into the egg because
Wow.
the sperms are very deficient in numbers.
How do you
we call that
determine-
ICSI. You understand? It's also an IVF means. So fertilization just happened outside the
Outside.
womb, and then the product of fertilization, after culturing and evaluation, is put back in the woman's womb, where it becomes pregnancy and carried like any other
Other.
pregnancy. And so that makes me worry about the term that's called artificial fertilization or something. When you use the word artificial, occasionally it presupposes that something was created from an unnatural means.
True.
And so you mentioned IVF, and you hear the couple say, it's this artificial fertilization, and I go, there's nothing artificial here. The product of fertilization, or the product used for the fertilization, comes from the human body. It comes from you and your partner, or whoever it is, from her, from the woman and her partner.
Okay.
And it's the same oocyte that will have been fertilized, that will have been fertilized in the woman if all things were
Which
okay.
actually brings me to the next question. But before I ask the question, everything you've talked about now, you do this.
Yeah, that's
your job.
That's my basic training. My subspecialization in gynecology is assisted reproduction technology. So I've been doing this for the past 16 years.